You were in pain for how many years?
7.
To within 1 year of you incorporating your own nervous system practices, your own mind body approach with yourself to being pain free in a year.
Yeah. Oh, maybe my urinary urgency is coming from these, things happening in my life that are keeping my nervous system in a constant state of fight or flight. Maybe that's why I have such tense pelvic floor muscles. It's not always just the tension, but what's the driver of the tension, right?
Okay, what is my body trying to tell me? And also, what are the things that are manifesting because I'm not listening? Welcome back to the What About Mom podcast and YouTube channel. We are so excited for you to be here today. I have a very special guest, and she's also a coach here at Your Postpartum PT. She specializes in working with our clients one-on-one in our Pelvic Floor and Core Restore program that are suffering with chronic pain, chronic tension, and really knows about it herself too from her personal journey. But most of all, she's also a occupational therapist, has her master's in occupational therapy, specializes in pelvic health, working with the preconception, pregnancy, and postpartum space, and also does a lot of our return to strength training and nutrition support for moms, even beyond that postpartum phase, looking to feel confident and strong and capable in their bodies again and playing with their kiddos. So, welcome on, Lindsay. I'm so excited to have you here.
Thank you for having me. I'm excited too.
Yeah, and one thing I left out of all of that is you also specialize in working as a mind body practitioner and with the nervous system specifically, which is where a lot of clients actually come to work with us because of your specialty as well. So tell me, like, what the heck is a mind body practitioner? What does that even mean, working with the nervous system? Because that's a very different approach than the traditional, like, pelvic floor rehab.
Yeah, that's a great question, right? So, I think in the traditional, Western medicine sense, the field tries to separate the mind from the body, and they cannot be separated, right? So that's where the nervous system comes into play. The nervous system, you can kind of think of it as our operating system that's constantly running in the background, dictating how anything in our body is going, minute by minute, day through day. And so, as a mind body practitioner, I'm really trained, beyond all of the other training that I have to look at a client holistically, right? So, really thinking about how do your thoughts, your beliefs, your stress, things that are happening in your life, how are they potentially impacting the pelvic health symptoms that you're experiencing or the pain that you have? So it just gives me more tools in the toolbox, essentially, to be a holistic practitioner.
Yeah, and I love that obviously because that's like what I believe in. And so much of our philosophy here at Your Postpartum BT is looking at the woman in the mom's body as a whole person. I think sometimes it's so easy for pelvic floor rehab providers to just get so stuck in the pelvis only, or maybe just looking slightly outside the pelvis of like, oh, yeah, we're incorporating the glutes and we're incorporating the hips, but it's still very musculoskeletal focused. And while that's not wrong, we do need musculoskeletal training, we also need to understand other things that are impacting our moms that we work with. Like what's really also some of those bigger root causes that might be contributing to exacerbating their symptoms or increasing their symptoms and also maybe contributing to the main reason that they're having those symptoms. Would you say like your approach helps identify those things outside of the pelvis more too?
Absolutely. Absolutely. I feel like not having that approach, not having the training, I would struggle to kind of help clients identify like, okay, yes, I know that maybe I know you have increased tension. I know you have weakness in this muscle group, yada, yada. But like now I also feel like I have the knowledge and understanding and experience to be like, okay, well, XYZ is going on in your life. You are dealing with this. How can I help you determine like, is this really the symptom driver? And if so, then that's going to look very different than us just doing exercises to resolve your issues.
Yeah, yeah. I think that's why we also have so many clients that end up coming to work with us that have seen a lot of other providers too. Like I've tried pelvic floor PT, I've tried general ortho PT. I've tried chiropractic care. So, like, if you're listening and that's you, maybe you just need a more of a mind body approach. But I'm thinking too of like some of our clients that you've recently worked with. What would you say are some of those outside contributing factors that maybe was increasing the pelvic heaviness or increasing their pain?
Yeah, yeah. So, I think some of it, especially being a mom, is the everyday overwhelm of mom life,
Absolutely.
right? And it's not just that we are putting our children first in all areas. It's that we truly have kind of lost this ability to take care of ourselves. And or we think that self-care looks like just scrolling on our phone at the end of the day or, maybe watching some reality TV. And while yes, we're physically resting our bodies, those aren't actually restorative ways that are going to bring our nervous system kind of out of that fight or flight that it's been in all throughout the day, right? So I think a lot of it is that overwhelm from motherhood with maybe just a lack of self-care that's truly restorative. Um, I also think there are situational things, right, that maybe kind of spark some of this trauma response in the body, and then we hold on to it if it's not appropriately resolved, right? So, worked with a lot of moms who've had really maybe traumatic birth experiences, or maybe they didn't have a traumatic experience per se, but maybe they've just had a lot of negative experiences with different types of medical providers, and they don't feel heard, they don't feel understood. Um, so I think those things are kind of the big things. From a more so like a personality perspective, I feel like a lot of women, tend to be, maybe a little bit of a perfectionist or a people pleaser or someone who feels like they have to be going to display their worth or, to feel worthy just internally. Um, and I also just want to highlight like this is all me. Like
I
I
was gonna
I
say, it sounds
am
like a lot
the
me too.
client. Yeah, like, but also like I've been the client. Like this is the reason that I'm so passionate about this. Like I dealt with chronic pain for 7 years. I was the person that went to all of the different practitioners, had all of the imaging done, had everything done. And finally figured out that like the root cause was coming more from the nervous system. So
Mhm,
just like to
mm.
throw that out there. Like I'm also speaking from experience.
Yeah, no, take us through that journey too, because I think that's such a powerful, unique perspective that you have. You were pelvic floor specialist in pelvic floor rehab before you incorporated more of the mind body stuff too, as well, right? Yeah. So
Yeah,
tell us,
yeah.
like,
So
yeah, like your perspective without that nervous system approach to now your perspective with it, through your journey as well.
yeah, right. So actually one of the big reasons I wanted to kind of transition into pelvic floor therapy was because I wanted to heal myself. Because no one that I had seen thus far could help me with my pain. Also just, recovering from my own postpartum experiences, but um I still couldn't help myself. Like, I learned all the tools. I learned dry needling, I learned anything and everything you could about like helping your SI joint feel better, but nothing would stick, right? And so it wasn't until I really kind of learned about this mind body approach. And at first I was like, I don't know how I feel about this. Like, this seems
Skeptical. Yeah.
weird. Yeah. But at that point, I was also just like, I literally have pain every single day. And it impacts my ability to play with my daughter. Like, I don't want to go run and chase her because then, like, where is that going to leave me later in the day? Right. So I went through this whole mind body approach with someone and like have not had pain since. And it was
Mm,
definitely a journey. Like I wouldn't say that like my pain was cured immediately in 1 month, right? Like it took 6 months to a year to really feel like I could say I'm not having pain anymore, but I did see like improvements throughout that time.
yeah, that's so
And
powerful.
so yeah,
Just can I, like, totally pause you for a second? Like, the
yeah,
transformation right there, like, you were in pain for how many years?
7.
7 years to within 1 year telling yourself through this or not telling yourself, feeling this experience, this transformation over the a year. of you incorporating your own nervous system practices, your own mind body approach with yourself to being pain free in a year.
Yeah, yeah,
That's
it's
incredible.
amazing. Yeah,
Yeah.
it's so amazing, right? And so then I was like, okay, well, the type of practitioner I am, I don't wanna just start doing things with clients because I myself have experienced it, so I sought out additional training, right? And, so I've taken numerous courses with, like, leaders in the mind-body field, and it has completely changed how I work with clients, like, 100%. In fact, I actually I mean, you know this, you've hired me, right? But I actually now prefer working with clients virtually because there is value in the in a hands-on technique for some people, absolutely. But um, I just feel like I can help my clients get so much better results when they don't have to rely on me and what I do for them. But
Yes.
when I can, empower them to do things for themselves. And I also just feel like when we acknowledge everything a woman is going through, like, again, not just when they're pregnant or when they're postpartum, but just like as a woman or like as an individual, what are you feeling? Like, when was the last time you let yourself cry? Like, when was the last time someone asked you like how you are and you could honestly tell them, right? And so being able to kind of be a safe space for women and kind of help them connect these dots, it's been amazing, and I also feel like my clients get better results and then results that last longer.
I could not agree more. That's exactly why I hired you and why I love having you on our team is because I was noticing the same exact thing, and both of us saw value in the hands-on approach for a very specific person for a very short period of time. Both of us individually worked with clients in person, and for both of us individually to also be like, "Why am I getting such better results online?" I actually love working with clients virtually. We're able to pass on that empowerment to them that their body is so intuitive, that their body can connect to its own inner wisdom and compass and find the healing from within. And then changing our paradigm as providers and our perspective as providers of like, we are not fixing you. We are not actually healing you. You are healing yourself. And we are just co facilitators in the process. Like that right there is how I felt moving from fully in person to fully online. I truly believed and felt that I was actually doing better by the client and they were able to have more tools in their toolbox for life. And then I found you and you believe the same exact thing and saw the same exact result in your own practice. And it's just, yeah, it's been so incredible having you a part of the team because of our philosophies are so similar in that aspect too. And our clients feel it.
Yes. Yes, wholeheartedly. Yeah, it's been amazing. And again, I think it's so easy to think about, from a mind body perspective like, oh, I'm thinking back to like school days, like, oh, I have a big presentation, like my stomach has butterflies in it or whatever, right? Like we normalize that and we normalize like, oh, I had a really stressful day. Now I have a headache. And we're like, oh, okay. But we really struggle sometimes. And I think, again, this is just how the medical field presents things, but we struggle to
Mhm.
relate, like, oh, maybe my urinary urgency is coming from these, things happening in my life that are keeping my nervous system in a constant state of fight or flight. Maybe that's why I have such tense pelvic floor muscles. It's not always just the tension. Like, yes, you have tension, but what's the driver of the tension, right? And
Yeah.
so often it's what's happening in our life that is causing us to clench and is causing us to stay tense.
Yes, like 1,000,000%. I feel like our musculoskeletal system, our body is literally like the response. It's just responding to what is going on in our environments. It's responding to the way that we live our life, the thoughts that we think, the emotions that we feel, the stress from work, the stress from being a mom and raising children, like all of the external stuff actually matters so much more than like what actually is going on in the body because until we get to that root cause and I know you believe this so wholeheartedly yourself is like until we get to the root cause we're just slapping band-aids on tension, we're just slapping band-aids on pain unless we really understand what is the driver, what is actually underneath all of that causing you to be having hypertension, for you to be having chronic tension and chronic pain in the body. What is actually the driver of that?
Right.
Uncovering that, peeling back those layers, and that's not standard of care health insurance,
No.
support.
No, unfortunately, right? It's so unfortunate, but it's not.
Mhm.
And I think the other thing we need to remember too is that our bodies are really resilient and they
Yes.
reliably heal themselves, right? So, yes, maybe you did initially have some sort of tissue injury, right? Like I'm thinking of, clients that have tearing during a vaginal delivery, right? Like you
Mhm.
clearly had an injury, right? And in that acute phase, it makes sense that you're going to have some discomfort. It makes sense that you're going to have some pain, but tissue reliably heals, right? And so when you're having symptoms that are lasting more than 3 to 6 months, it is more so because your nervous system is now sensitized. And so if you just are only addressing the tissue or you're only addressing the injury that has likely now healed, you're just not going to see the results that you want to see. And we see this over and over again with our clients.
Yeah, we see this over again, especially if you've had an injury that's more than, 60 to 90 days. That would be like acute injury, right? So if you're
Right.
kind of listening and you're like, wait a second, am I in acute or am I in chronic? What does that really mean? Break down for us like what you would consider acute injury, the response that you typically would see in the body for an acute injury versus how would somebody know, wait a second, maybe I am living more in chronic tension or chronic pain and having chronic symptoms that really needs a different approach than the traditional rehab method would normally give us.
Yeah, right. So, I mean, kind of like you said, I think really anything, under 90 days is going to be more of that acute injury response. However, not everything is an injury, right? So,
Mhm.
like I'm thinking, a lot of times these overuse injuries are not actually always overuse injuries. Our body likes to get our attention, right? And so my pain started out with an overuse injury, so to speak, but when I from an emotional standpoint really think back to that time in my life when it started, there was a lot going on and I was ignoring all of it. Like I
Yeah.
was just shoving it aside and knowing what I know, I'm like, "Oh, it makes sense." Like my body was trying to get me to take a break in some way or another, and this was the way that it decided it was gonna get my attention, and it did. Very well
Yeah.
got my attention, right? So, but when you do have an actual injury like a tear, like there is visibly something happening, right? In that acute phase, like there's going to be inflammation because that is how the body repairs itself. There is likely going to be discomfort because that is your brain's way of making you be aware of the area so that we aren't further damaging it, right? Um, but again, once that healing has kind of gone through its process, ideally the pain should disappear. And if it's not because you're still injured, right?
Mhm.
It's because your nervous system has gone into overdrive and it's continuing to send you pain signals. Um, and so there's ways that we can help you essentially unlearn that sensitivity, right? And for those of you that just have pain that kind of comes out of nowhere, that's when I really invite people to start thinking about like, okay, like what is my body trying to help me do, right? I often feel like a lot of those women who are go-getters and go, 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 the pain comes at like the worst time. And it's literally like, have you given yourself a break recently? Like your
Yeah.
body's forcing you to take a break,
Mhm.
right?
Mhm.
Like there's this, phrase where it's like, if you don't learn to say no, like your body's going to say it for you at some point. And
Mhm.
that's literally what my body did. But then unfortunately, because I wasn't addressing the underlying issue, it continued to tell me that for 7 years
Right, and
until I
and that's
finally went back. Yeah.
it's wild. It's interesting when we just, like, shift our perspective too with this, thinking of, "Okay, what is my body trying to tell me?" And also, what are the things that are manifesting because I'm not listening? And so I think this is why we also consistently see women have higher autoimmune issues, women being in chronic pain for longer, women having very long-standing pelvic floor issues that they're not addressing. The whenever I hear about these very, like, real medical, presentations, it's also the body's way of trying to scream and tell us something.
Mm,
So I
yes.
think that, if you're living with any of these conditions, I think it's really important that you start asking yourself, like, what are a couple questions that you would give a client, or what are some practices maybe that you would give a client to come back into awareness and to start getting connected to their body again, that can help them start realizing that they're just living in overdrive, and that's maybe what's causing all of these other things to manifest health-wise for them.
Yeah, that's a great question because I do feel like so there's kind of, 2 ends of the spectrum, right? So I have clients who are incredibly disconnected from their bodies, right? They're like
Mhm.
so disconnected. They're so far away from it. They're like, I have zero idea what my body is telling me, with the exception of like where their symptom is. Okay.
Yeah.
But then there's other clients who are like hyper vigilant to like any sensation or
Yeah.
anything that they think is out of the norm in their body, right? And so they're just hyper focused on all of that. So it kind of depends, like, which end of the spectrum we're on, right? But so for the ones that are super, super disconnected, like, I love just having them be like, "Okay, can we pause? Can you just you're not trying to change anything. I literally just want you to pay attention, scan your body. How are you breathing? Are
Mhm.
you breathing faster? Are you taking more shallow breaths? Can you feel your breath kind of come down and into your belly? Or does it feel like it's more like up in your upper chest and your neck? Um, just see, right? And that right there alone is going to kind of tell you, like, am I in a little bit more fight or flight, or am I in that rest and digest, right? So
Mhm.
if we're in fight or flight, our body is prepping us to run away or to fight back. So we're going to be breathing faster. We're going to be breathing more shallow. Um, if we're in that rest and digest, we're going to be breathing slower, right? And so I think starting with the breath is such a simple way to get someone to recognize, like, oh, maybe I am living a little bit upregulated, right? Um, if that feels hard to do, or it feels like it makes you twitchy and like I can't sit here and actually pay attention, that in itself is a sign, right? That your nervous system is like seriously on overload and it doesn't feel safe to rest, which is a
Mhm.
problem.
Yeah.
Like, it's a problem, right? Like you with anything, right? With an actual injury with your pelvic floor, like post birth, like you only heal and heal well when your body has the capacity to enter a state of rest and digest. And if you can't get there, when you're awake, right? This can't only be happening when you're sleeping, but if you can't get there when you're awake, you're not optimizing recovery,
Mhm. Yeah.
right? And
Yeah, and
then
that's
so for the oops, sorry, go ahead.
no, we're just gonna edit that, Zeke, and then we'll just let her keep going to the second number 2.
And then so for the, the client that maybe is more like hyper vigilant and hyper focused on all of these sensations, a lot of times I like to start with like taking them out of their body. And again, we want to bring them down. We want to down regulate them, but can you simply focus on your environment? Right? So can we shift to something outside of us, something though that is peaceful and pleasant? And how does that make you feel? Right? It's
Mhm.
all about learning how to tune into your body and what's happening, right? And a lot of this does require you to slow down even just a little bit, and that in itself feels really, really hard for a lot of women and a lot of moms because so much of our life is not slow.
Especially our high achieving, ambitious moms who are go, 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 whether you're still working and still living the, juggling your career and motherhood, or you're just like in full mama drive at home with multiple kiddos and doing the thing day in and day out. it can be so easy to get stuck in that state too. And what I really hear
Yes.
from you too, of taking our clients through this, it's like a grounding practice, but also to the specialization of people might need different grounding practices because the
Mhm.
person who is so fixated on their right ilium that's rotated 2 degrees further, forward, and their sacrum is slightly tilted, like they're too fixated on the tiny little pieces of their body. The grounding practice is actually like, what did you see a bird today? Like, did you sit?
Right,
Did you
yeah.
like what does the grass feel like on your body? Like when you sit down in the lawn. And then it's the opposite of like those people who are so disconnected. They're constantly paying attention to everybody else. They're always caring for the kids and their partner and their work, and they just give their whole life away to everybody else, but then they feel so disconnected from what do I like? What are my desires? Like what is going on inside of my body? The practice for grounding is different for them because it's actually, okay, let's like bring you back inward to yourself. Let's focus on like your breath and your own breathing patterns. And so I love how you also are like, even nervous system work is like, yes, for grounding, yes, for finding safety in the body, but each individual person still really needs their own individualized, like customized approach to how we're going to be able to access that for them.
Oh, wholeheartedly, and, I think there are a lot of, nervous system programs out there that are not individualized, and I think a lot of I do think they have some value, but I also think that a lot of times, one, they're not symptom specific, and a lot of times clients need symptom specifics, like, to help them actually overcome that particular symptom, right? But also they're not person specific. And
Mhm,
so it can be really hard when you've never done this to figure out, well, where is my nervous system right now? So how do I know what it needs? And then, one of the other big missing pieces is co-regulation, right? Which is
mm,
basically just this idea of there is a person who is a calming presence and can help guide you through the process, right? And so that's me as a coach. Um, and it's so invaluable to have that connection with someone. Also, because of the way our world is now, like we're not, it isn't like families that they're all living together under one roof and you have all of the help in the world from all of the other mothers around us, right? Like we're so isolated. We think we're not because we're connected with social media, but we're so isolated, and that co-regulation piece, that having a relationship with someone else, someone whose nervous system is in a better state than yours,
mhm.
is so 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 valuable and like a very big missing piece.
I could not agree more, and I think that's why it's so valuable and important to have a coach, especially a coach like you, Lindsay, like, is because it's also somebody outside of your family dynamics too. I think that there's, like, this heavy emphasis that your spouse has to be all the things for you, and they also have to be your co-regulator, and I'm like, your own nervous system, your own body is like your responsibility. And that doesn't mean that we can't have support in the home to be aware of those symptoms for yourself or be aware and like help guide you. But if it is something where you're really noticing you're so disconnected from your body or you're so fixated on your body, one of those two, having an outside coach who literally specializes that in nervous system work, mind body connection, and does this day in and day out is so crucial and important, especially if you are dealing with pelvic floor issues. And I want to like pivot to this piece and kind of loop back in the pelvic floor because that's the uniqueness that, our program and our company and you as a coach also bring is like, yes, we can dive into nervous system safety and mind body stuff all of the time, but also like the attachment to the specialization of pelvic health, pregnancy, postpartum is so hyper niche and is such an important thing to connect together because there's a lot of people out there that do pelvic floor rehab. And like you said, a lot of generic apps out there that do musculoskeletal work. But when you connect the two together, it's so much more powerful in your healing process. So I guess I'm also curious, obviously, from the client history that you've had, what are some common pelvic floor related symptoms that people might not even be associating to being a pelvic floor issue? that are likely influenced by the nervous system, but that might be presenting more of like, oh, I'm noticing X, Y, and Z throughout my day that's pelvic floor related. So I think it's just a pelvic floor problem.
Yeah, so this is where it depends on the person, right? Because I've been finding that even issues that I never thought would be like mind, body, and nervous system related really can be, right? So I feel like more on the surface, right? Obviously, chronic pelvic pain, and that could literally be anywhere in the pelvis, right?
Yeah.
So that could be your chronic SI joint pain, chronic low back pain, chronic hip pain, sit bone pain, but that could also be, pain with any sort of penetration that's been going on for more than 90 days. Um, and more of the chronic sensations, things like heaviness from prolapse, right? Or some of those other uncomfortable sensations you might feel with that. Um, Urinary urgency, I feel like is a huge one. But then I've also had clients where, kind of along with the musculoskeletal stuff, when we add in the nervous system component, it makes a drastic difference with their leakage, like their stress
Hmm.
incontinence or constipation is a huge one that is, nervous system related. So any of them could
All of the pelvic floor issues. Did you guys hear
like
that? There
all of
isn't
the
one.
pelvic floor issues might have, but again, it really depends on the person. It depends on what's going
Mhm.
on in your life. But that's why I like having this as my background because then if I initially think it's something that is purely musculoskeletal, but I'm not quite getting the results that I would anticipate, I have the capacity to kind of shift focus and dive deeper into the client's life and be like, what's going on in your life right now? Talk to me about this, right? And there's often just light bulbs that go off. And it's like, oh, that makes so much sense.
You bring
We can
up
address
such a
this in
great
a different
point.
way.
It's so important to ask those other questions too. I mean, I think that's one thing we do uniquely also on our intake form when clients come into us. We're asking about like all the bladder habits, all the bowel habits, but we're also asking, what are your stress levels like on a day to day? What's your sleep like? It's really, we're
Yeah.
trying to get a good snapshot picture. But one thing you said there that's so crucial, I think that I really want listeners to hear is like, if you're not getting the results that we would expect from like a musculoskeletal only approach, right? So if you're going to ortho PT or you're going to pelvic floor specific PT or you're going to chiropractic and you're getting the dry needling and you're getting all of the things that are supposed to help the musculoskeletal quote unquote injury or dysfunction that's currently going on, but you've been doing it for longer than what, 2 or 3 months, and you're really not getting the changes and you're really not seeing that momentum and the traction of the progress, this is a sign that you need to maybe work with us or work with somebody who also can integrate a mind body practice, who can also look at the nervous system space. So if you've been going to a pelvic floor PT for 3 plus months and you're really not seeing the results, you likely need a different approach. Also, maybe you haven't gone to pelvic floor rehab yet. Maybe you haven't tried that aspect yet, but you're listening to this and you're also thinking, well, I've also had pelvic pain, bladder urgency and frequency for the last 5 years, and intimacy has never really felt that comfortable, or I've kind of always had SI joint pain, back pain. This is also your sign to source out and find a provider that is also specialized in this approach too, because what will happen is you'll finally get up the courage, you'll finally take the time, you'll finally make the financial investment to go and invest in yourself, thinking that this person is going to help you. But if they really are not also additionally looking at the nervous system, the stress response in your body, that mind body approach, and you have been struggling for more than 3 months, you probably are not going to get the changes or make the results that you're looking for. And that's so sad. And we see that all the time happen,
Yeah. All the time.
all the time. And then they come to us and they're like, oh, is this going to be different? It's like you can't really explain it until you receive it. So I guess this is just our little memo to you of like, if you have been struggling for so long and you really are looking for a solution that is going to look at your body holistically. You have the bladder urgency and frequency, the back pain, the SI joint pain, and you really want to get out of having pelvic pain, but not in a quick fix way and a band aid fix way and a hands on only approach way, then it is time to definitely look at a mind body approach. And we would love to take that next step with you if you're interested. I'm sure you would love to work with them too, Lindsay.
Oh, wholeheartedly. Like, brings me so much joy.
Yes, yes. So feel free to just click the link below. We'll go ahead and I'll link, a way for you to book a call with me directly or my team, so you can learn a little bit more about what working with us is like. It's a free inquiry call. You're able to learn more about what working with Lindsay directly would be like as well, so that we can really get you a holistic approach that's gonna really move the needle long term for you and give you more tools in your toolbox and stop making you feel like you're broken and you're never fixed and no one can help you. And these are all things that we hear all the time before we take on clients with this approach and really see a drastic change in not only their life, their mindset, their belief patterns, everything like that too. So thank you so much, Lindsay, for being
Thank
here and
you.
yeah, sharing your wisdom with us and the women and moms that listen to this podcast.
Thank you. Thank you.